Alors, oui, bonjour et bienvenue. Mon nom est Kelly Thorstad, je suis la directrice aux soins à l'hôpital Shriners pour enfants. Et nous avons prévu une journée formidable aujourd'hui. Et la conférence se déroula en anglais car les participants viennent de tout le Canada et des États-Unis par le Teams. Toutefois, si vous souhaitez le contenu de la conférence soit rédigé en français, nous pouvons l'obtenir pour vous et bien entendu, nous pouvons vous aider à traduire toutes les questions aussi en français pour aujourd'hui. So good morning, everyone. My name is Kelly Thorstad. I'm the Director of Patient Care Services at the Shriners Hospitals for Children Canada. For those of you who are English speaking, I just explained to our Francophone guests that we will continue in English because we have people from across Canada and the United States joining us today, and we're very delighted to have everyone. Before we begin, it is important that we acknowledge reconciliation that is going on across Canada. But I was very inspired by a speaker that we had in Halifax who mentioned that it is not just to say land acknowledgements just to do it. So I wanted to read to you something that I found very inspiring. When we talk about land, land is part of who we are. It is a mixture of our blood, our past, our current, and our future. We carry our ancestors in us, and they're around us, as you all do. This was from Mary Lyons, the Leech Lake Band of Ojibwa. And so I just want to recognize the suffering, the sacrifices, but also the successes and the contributions of the Indigenous peoples and communities of the land that we are presently on. And I wish you all a wonderful day. With relation to our Indigenous work, one thing that we are supposed to commit to in our land acknowledgements is what we are going to do to promote awareness. And so I was so excited that Argerie has discovered that we have some Indigenous VR work, and so we're committed to looking further at that to be able to provide that and integrate that into our clinical practice. So, once again, welcome. Look around this room. This is an exciting day. It has been a long time coming together. The wealth of knowledge, the excited clinicians. We have partnerships from many different areas. So thank you for being here. Thank you for your commitment to wanting to improve the experience of children who have to undergo painful procedures or have anxiety. That is why I think we're all here, and I think it's wonderful that there are so many people committed to it. So in opening, I just want to acknowledge the wonderful work of our nursing research team. They have worked so hard to pull this all together, along with collaborations from our clinical advisors and collaborators. But this would not be possible if we did not have Dr. Argerie Tsimicalis as our nurse scientist here to help lead the way and support us. And also, we had the beginnings of the innovation back in 2018 with Dr. Reggie Handy, who was our chief of staff at the time, who conducted various focus groups with the healthcare team to brainstorm the use of VR at our hospital. And he has always been a pioneer in innovation. And then when you team up him and Argerie, look what you get. But I would be remiss if I did not acknowledge that we are not here alone. We have wonderful partners. Dr. Sylvie Lemay is here. Others, Paper Plane, who has supported us in our initial endeavors. Those partnerships are important. Collaborations are important. So as we continue with this day, I invite you all to learn from one another, look around, see what you can do to improve the lives of patients and families, because after all, that is why we're here, to help reduce anxiety, to reduce pain, and improve the overall experience of our patients and families. So, without further ado, Argerie, please come and take the stage, and I wish you all a wonderful day.
Good morning, everybody. Lovely to see you. Let me
I'm
see.
taking mine away. I left the wrong one. Sorry.
That's okay. Andres, I go here. There we go. There we go. And I bring this forward. Okay. I'm delighted to be here today to share with you some of the preliminary findings that we had as part of our study, but also to welcome you to this day to bring everybody together who are interested in VR. So the topic for myself for the event is to provide a little bit of an overview about the barriers, facilitators, and the contextual challenges of the use of virtual reality. And with that, I wanted to indicate that I have no conflicts of interest to declare. I'm not making money off of the VR. I'm pushing forward because the kids want it. So that's my true pursuit here. We know back from some of the work from Dr. Hoffman, who introduced VR to relieve children from painful burn procedures. And so that's the pioneering work that we're leveraging and moving forward with. And so my kids were staring in amazement of these slides because he was able to reduce the painful experiences that children encounter as a result of the painful debridement that is associated with cleaning the wounds and introduce the use of Snow World. I also know that Sylvie Lemay, when she introduced the software at Saint Justine, the nurses got very upset when the trial was done and she removed it. She was not allowed to do that. So that really spoke to how important this innovation was for clinical practice. We also know that there's been, since then, many different studies that showcase the effectiveness to reduce procedural pain and anxiety in children when they're using VR. Yet, ongoing challenges, which we all encounter in healthcare, is the continuous lag from pushing for bringing evidence into practice, and the same with virtual reality. And as a result, in this case, the delays of integrating the evidence into practice continues, where children continue to encounter pain, anxiety, and many other different issues in their encounters in healthcare. And so at Shriners, there's notion, are we ready to adopt VR? And so I'll briefly share with you our quick little journey that we undertook. And so that did, as Kelly mentioned, started with Dr. Reggie Hamdi, who as the chief of staff and also leading the Center for Simulation, brought VR, a big clunky device, machinery to the hospital, and said, who wants to try it? And with that was multiple stakeholder engagements, consultations with everybody in the hospital to see, are we ready? And that then through this, he came to me and I said, Dr. Hamdi, if we are going to do this, well, we need research in order to do that. And then that's where, and I said, oh, and by the way, I found us a student, and we were very fortunate to have Sophia Adab, who many of you have encountered through all the emails, who came to us as our student to do the literature review that was needed, the pilot study that was needed, but also because I knew nothing about VR, I reached out to Sylvie Lemay and I said, please help. And with that, big open arms, come, we'll figure out, we'll do the pilot, which was a study that was funded by CHR for Sylvie to take a look at the use of the iPads versus virtual reality for the removal of pins and sutures. As we were going through in the feasibility study, trying to figure out how can we use VR throughout the hospital, COVID struck. And then next thing you know, well, we can't really figure it out right now in the OR. So as things later on started to open up again, we were very fortunate that we were able to continue with Sophia's work after she graduated, and we piloted the use of VR for the perioperative journey, not just at a time of induction, throughout all the moments throughout the journey of a child who has arrived in the morning for surgery, and how can we figure this out and use it into practice. Then came a lovely initiative with Investissement Quebec, with Paper Planes, who continued to provide us with the software to be able to use for research purposes. We received a grant together that allowed us to begin the process of implementing it into practice. As a result of those efforts, there was also an opportunity with the RSBO, which is the Bone and Oral Health Research Network that recently got renewed. We received an infrastructure grant to create a knowledge mobilization hub to share what we're doing and to share our lessons learned, but also to help mobilize all of Quebec to embrace the use of virtual reality, at least in this context in children's healthcare, because that's where we are able to influence primarily. And so that was our brief journey. Along the way, we created a VR council. And so there's a few of us here in the room that you might recognize. Also recognizing the important role of family-centered care. And here at Shriners, we're in the process of doing our certification of Plain Tree and International and creating the structure that is needed to properly recognize the voices of patients and families. But I have lovely families who are supporting our work, and our lab is here in the hospital. He has an appointment at 10. So at some point, we hope that they'll be able to pass by and greet us. But they've been big proponents, leaders in advocating for this use. Along the way, with the infrastructure grant, our network started expanding, welcoming different colleagues from different disciplines and from different centers. And with that, I welcome you as you start seeing the network. As we post that on the website further and further, your space is available for you as well, to be recognized as champions, as leaders, as collaborators, in whatever way you think you'd like to contribute. At Shriners, we officially announced it that, hold on one second. We officially announced it via a press launch that we have VR at the hospital. So that was a grand day with many, many news stories as a result. So the media likes VR. And so we can leverage that. And here it is saying we're actually using it into practice. But the reality is it's up and down, right? There's innovation that comes in. Sometimes it's working really well, sometimes it's not. And we're in constant mode of troubleshooting. So I've got one headset that was really, really well used. And Angie is somewhere, who's our child life, constantly championing, figuring it out, and allowing her the protected time that is needed to spend time with the children who have the traumas. And that's the precious gift that VR gave her, and the gift that we gave to the children, that they're learning other tools. But then ups and downs in clinics, the other headset at that point, at that snapshot of time, wasn't being used as well. This then, because as we're constantly troubleshooting, it led to the creation of our Knowledge Mobilization Hub, where we have, 3 objectives for our Knowledge Mobilization Hub. One is to be able to assess the barriers, facilitators, and context of use of VR, to really understand where we are here in Montreal, Greater Quebec, to understand where we're at in terms of the status of the use of VR, to be able to offer training, which is today's event, to be able to offer whatever knowledge that we've learned along the way, to bring all of our VR companies together, to be able to collectively train and exchange, and then to collaboratively develop more resources. We started, but to create more resources, more structures, more policies, so that we can embrace this into our practice. And so in terms of readiness to we used a participatory framework organizational to try to piece together, but those were the 3 things that I just mentioned. So using our VR survey, training, and developing resources. It is situated within the KTA Knowledge Translation Framework that is helping guide our thinking. And the Adopt VR survey was developed here locally in Quebec. So I encourage you all to reach out to the authors also, so that you can use it if you'd like in your respective practices to assess the knowledge of your population. Of course, you're most welcome to share your initial assessment with us as we continue to collect this data to get a little snapshot over time of where we're at. But what we can do is share with you at the time when we analyze the data, that we had 47 individuals who had completed it, far less than what you had just seen in the previous slide of where it was sampled across Canada with a sample of 1,000, which was a few years back. However, we have a nice little mixture of different clinicians who have expressed their initial facilitators, barriers, and contextual challenges. But you'll see that the scores are quite similar in the end, indicating that we still are, we're at the beginning stages in terms of Quebec, in terms of knowing about VR, and then being able to push it forward into our practice. And so the scores, we have a mean score of 5.1 out of 10, so we're just starting. And so in terms of attitude, we do have a pretty good attitude, at least from the sample that was who are participated, pretty good attitude towards an openness to bring VR into practice, the perception that it can be somewhat useful, so with a score of just under 7, and whether it's perceived ease of use remains much lower. And so these are then, as a result of the workshops, and we're able to then show how it can be used. Question whether or not it's compatible with our practice, and I can appreciate the ups and downs of trying to integrate this into a practice, and Yutong's posters in the back, which talks about it, how it was used in the perioperative setting. Social norms, whether or not I'm going to use it because someone else, low. Whether or not I'm going to use it because my clients want it, not as high. And I can tell you, a lab really wants it. And then I can tell you on the bottom, which is my personal experience with my son, emergency surgery, playing around with different distractions, he really wants it. And I can prove to you that it works, but I can't really show the video because I did it illegally in the hospital, okay? But I can tell you he really wants it because I brought the VR he wants, because he knew that it works, okay? Whether or not we're influenced by our peers, we're not doing it because our peers are doing it, but whether or not our superiors, are we going to be influenced by our superiors? Not necessarily, but we've got some great leaders here who are encouraging and creating this space for us to try it. And then these are the perceived behavioral control. And these are areas about, I'm familiar with the virtual reality games available to me, I'm familiar with the current evidence, I have access to the resources, and I have knowledge to make the use of it readily available. We got really low scores. But I do hope after today, plus letting people know about the cumulative resources that we've created, that at least there could be a way to help influence the scores, address what is needed to be created, and help give you what you need to take off. In terms of barriers, and we have Guillaume here as well, who also share what do you do with all these barriers. But we have lots of them, and I think that many of them that we see are ones that we see often when it comes to integrating other types of evidence into our practice. So a lack of support staff, lack of assistance, lack of funds, poor match with patient needs, space issues, all those things we've troubleshooted, and we can offer solutions along the way. And then I still have more of a laundry list here, thanks to our participants who had shared them. But again, these are all different barriers that we will encounter when we're introducing various different evidence into practice. In terms of preliminary results for the facilitators, we want access to education, we want time to learn it, we want access to the evidence, we want support from our management, we want our patients to be motivated, we want technical support, and we have Andres here, who is an excellent example. I'm almost done, Sophia. And we want the time to use. In terms of self-efficacy scores, we're still low. We're at 57, so that makes us a D or C, no, a D. So we got room to build our self-efficacy scores to bring it up. And this is one resource that can help us do it. And behavioral intention, we're on the fence in terms of whether or not we're going to do it, because it takes a lot of support to be able to bring this. This has led to the co-development of various resources on our website, and so I encourage you to take a look at them. Many of them are examples here. We have on the back wall, on the table, we have some printed, some that are available. And today's event, where we have Sylvie and Stéphane, who will give us very good evidence in terms of supporting it. We have our VR companies here, we have our trainees, we have our researchers who are sharing the latest evidence to help push that forward. And then in the afternoon, we have Guillaume, who will help us figure out how do you take all this evidence and put it into practice. And we have our future generation. So we have Jacqueline, who's just finishing her BNI, who has lived a life with pain, and who is our future generation in terms of healthcare professionals who will help us take us down the path of what we got to do to move forward. With Guillaume, we're going to ask you to share your implementation thinking, the drafts, so we can analyze that and create a structure so that we can help you along the way. So not everything falls on you. And that will allow us to continue to develop more resources, provide more consultations, apply for funding to do more workshops such as this. And I've learned along the way, well, you introduce VR, you open up a can of worms. And so now this has led to the process of thinking, can we become certified? Can we become part of Childkind? I know the Children's is not part of it yet, and I know Saint-Justine's thinking. So we can become Childkind certified as a city, and we can share the cost to bring Bonnie Stevens, my former supervisor, to help do the assessment, but we can work together to do this. Childkind has no VR resources. So this is something unique that we can contribute to them, which will influence internationally the rest of the institutions who are part of it. We also are very beneficial to have SKIP, our national resource, to be able to share all this knowledge, who have given you all a nice pack so that you can take with you. And also to remind you that they have brilliant standard practices now, and Kelly was part of that committee, and there's brochures on the table in the back seat. We also want to be able to come up with innovative ways to translate this knowledge, and so with that, I welcome you all to think through if you want to have some fun and make a comic book with me. We'll be at the back table over lunch talking about how to make this happen. We make cartoons, and so that's another fun way to get the knowledge out. Thanks to Saint-Justine and my experience there, I bring you an I Spy, reminding that a distraction is powerful, even if you don't have the VR, and we have the back room with Child Life along the way. And with that, VR can be used for many reasons, many purposes, and then I learned along the way that we can also use VR to help share, present, learn about the history of the people, the Indigenous people, help educate our people moving forward. It's being used to help revitalize the lost languages. It's being used to educate the children. And so I have found, and I reached out to them because I just found this, but I reached out to them to see whether or not there could be an opportunity to working together. Oops. One sec. This is a immersive link that I found. It's in Thunder Bay, and they're creating all kinds of software. It also helps to promote the return to work for the Indigenous people to be able to do that as well. And there is other softwares for the languages and to introduce that into the schools. And, sorry, one more. And so with that, I thank you very much. Please take advantage of this day. connect with people, learn about it, email us afterwards. We're more than happy to figure out what we can do to have everybody's names, champions, booths, whatever on our website. So we build this nice, lovely hub. Montreal is a dynamic city for this, and we can have a lot of fun bringing it forward into practice. So thank you.